Well, I'm excited. I'll have everybody kind of mute themselves, and you're welcome to leave your camera on or off, but I'm excited to let Anne introduce herself, tell us about herself, and take over for her presentation.
Okay, so I'm Anne Baldwin, and I live in Tucson, and my business is Mind Body Science. I'm a physiologist, so I was a professor of physiology at the University of Arizona, and I retired a couple of years ago, so now I'm Professor Emerita. And I started off looking at cardiovascular system and doing research and teaching the cardiovascular system and teaching medical students. And then I shifted into stress because I was doing experiments on rats, and I changed the place where I was doing the experiments. So they were in a different animal facility. I was at the VA and then switched to the University of Arizona. And the experiments didn't work anymore. And I found out it was because the rats were stressed by their environment. And it was actually affecting the intestine. The intestine was getting inflamed. So I did some experiments in that area of stress and rats and noise, because it was the noise that was the problem. And then I slowly decided that I would rather work with people. I thought that maybe I could be of more use to people than to rats, because I had I kind of made my mark there and managed to get animal facilities to take notice of how they were keeping the animals a bit more and put them in less stressful situation. So I started my business, Mind Body Science, and I still work part-time at the university. So in my business, I help people who are stressed, and I help them with biofeedback, heart rate variability biofeedback. I'm a certified heart math trainer, so I don't know how many of you are familiar with the Institute of Heart Math, but they have some very good programs. And then I'm a Reiki master, so I do Reiki, give Reiki sessions and train people in Reiki. And then I'm a horse owner and rider, and I I have volunteered for Therapeutic Riding of Tucson for decades, and so I sometimes take my clients to the stables to work with horses, equine assisted learning, and that really helps them with kind of getting in touch with their body and releasing their stress. So that's what I do. And I'm going to talk about my new book, which is called The Vagus Nerve in Therapeutic Practice, Working with Clients to Manage Stress and Enhance Mind-Body Function. And this book came out less than a year ago. So I'm going to switch to my PowerPoint. So I'm going to share the screen. Okay, so can everyone see that?
Good. Yep, good to go.
Right. So I'm going to talk about Reiki as well. I'm going to leave that till the end. And just to let you know, actually, the Reiki part was the chapter I didn't include in the book because I've already written a book on Reiki in clinical practice. So I didn't write about Reiki in this book. So you're going to hear the chapter that was never included as well. So an outline of what I'm going to talk about. So what is the vagus nerve? And hearing all your backgrounds, I'm sure everyone here knows exactly what the vagus nerve is. How does it keep us healthy? What happens to it when we get stressed? And then what inspired me to write the book? A little bit more about the book, and more about the vagus nerve, especially because one unique thing about the book is that I focus on the anatomy of the vagus nerve and the whole vagal complex, and how we can choose different parts of the different branches of the vagus nerve to focus on, and what kinds of activities will stimulate those various parts of the vagal complex. Then I'll talk about Reiki. What about Reiki? How does Reiki help the vagus nerve function? and then combining Reiki with some other techniques to power up the vagus nerve. So here we have the goals. So anatomy and functions of the vagus complex. So the vagus complex is the vagus nerve is part of this whole structure called the vagus complex, which consists of 12 cranial nerves, of which the vagus is number 10. So most of the other cranial nerves are to do with the head and the senses, and the vagus nerve is the longest nerve in the body, and so the most important nerve in this vagus complex, and it also has many branches, which I'll talk about. Then you will learn about different ways of activating the vagus complex and how they relate to its anatomy. Then we'll talk about scientific evidence that Reiki healing operates through the vagus nerve. And then we'll end with the influence of deep, slow breathing on vagus activation and heart rate variability. And we'll do some deep, slow breathing together. So vagus nerve, the longest nerve that you have, it goes all the way from the base of the skull, the brainstem, all the way to the coccyx, the base of the spine. And there are actually two vagus nerves, left and right, but we always shorten it by saying the vagus nerve. And you can see it has many branches, especially into the heart and into the intestine. It has other branches too, which I will mention later, but those really, the heart and the intestine are really the big neural networks that the vagus nerve services. And the main job of the vagus nerve, it has many jobs, but one big job is that it lets the mind or the brain know what's going on in the body. Knowing what's going on in all those different organs, especially the heart and the digestive tract. So, for example, if you're at the airport and you have a connection and you're running to get to the right gate in time, and you can feel your heart pounding, and your heart is, consuming more oxygen, all that information is going to the brain via the vagus nerve. And then also, supposing you've eaten something that doesn't agree with you, then you will start getting maybe an inflammatory response and various cytokines being secreted. And that information will also go to the brain via the vagus nerve. So then the brain has the information about what's going on in the body, and then it can react in appropriate ways. So it's not just a one-way path. It's not just the vagus nerve going from the body to the brain. It goes both ways. So this is a complicated diagram, but I'm just going to point out a few things. So we have the heart here on the right. And the heart actually has its own intrinsic nervous system. So there are neurons in the heart tissue, chemosensory neurons, that are sensitive to the chemicals in the heart tissue. And these neurons pass that information from the tissue to the intrinsic nervous system of the heart. And then that can relay that information to the SA node, the sinoatrial node, which regulates cardiac contraction, and then also the AV node, which regulates the heartbeat. So depending on the chemicals in the heart tissue, and also the tension, mechanosensory neurons detect tension in the heart tissue. That all is fed into the intrinsic nervous system of the heart, and then the heart can react by changing its contractility or the heart rate. Anyway, but we're interested in the information going from the heart to the brain. So you can see this red arrow here, afferent pathway. So that's through the vagus nerve. Afferent means like to the brain. And then also you can see this yellow arrow, parasympathetic. So this arrow is relaying messages along the vagus nerve from the brain back to the heart. So, for example, if you're running to get your connection at the airport, And then you get to the gate, you get on the plane, you're sitting down, you're not running anymore. That information is passed through the vagus nerve to the brain, and then the brain uses that information to calm down the heart. You don't need any to have it beating very fast now because you're sitting down. So there's the two-way path of the vagus nerve. So the vagus nerve has sensory fibers going from the organs to the brain, and then motor fibers going from the brain to the organs. So that's very special about the vagus nerve. It has both kinds of fibers. So I think I will go on to the next slide. And so this brings us into the rest of the autonomic nervous system. So the vagus complex is really the parasympathetic system, or the rest and digest. And then it works in conjunction with the sympathetic component of the autonomic nervous system, which puts you in fight or flight. And so it's important to know that if you get too stressed, then the vagus nerve doesn't work so well. So remember, the vagus nerve, it has that function of bringing the information from the organs, from the body to the brain. And also it regulates the passage of food through the intestinal tract. And so the vagus nerve, if the vagus nerve isn't working properly, you might get digestive problems, which happens when you get stressed. The vagus nerve just can't work so well because it's competing with the sympathetic or fight or flight. Another thing that the vagus nerve does is, here you can see slows down heartbeat. It does that, but it does something even more interesting. It not only slows down the heartbeat, but it actually fine tunes how the heart rate varies with time. And by fine tuning how the heart rate varies with time, it can send that information back to the brain, and that helps you think more clearly and regulate your emotions better. So the vagus nerve is working through the heart to help your brain function better. So that's an important point here. And when you're overstressed, that is not happening, and the fine tuning of the heart rhythm is gone. And so that's when you get the fuzzy thinking and the dysregulated emotions. And then you can see further down, vagus nerve branching off into the intestine stimulates peristalsis and secretion, so digestion and passage of food along the intestine. So those are the main functions here of these branches. And then you can see the sympathetic is going to do the opposite. So it's going to accelerate heart rate, and it's going to inhibit digestion. You can see also, apart from the vagus nerve and its branches to the heart and the lungs and the intestine, you can also see some other nerves coming off on the parasympathetic side. And these are cranial nerves. And so remember, there are 12 cranial nerves, and the vagus is just one of them. And so these cranial nerves, they're not all drawn in here, but you can see one going to the eye. So one cranial nerve will operate the eye movement, stimulate flow of saliva, then also olfaction, smelling. So the vagus nerve, or the vagal complex, is very important for using the senses. Oops. Okay, so I'm going to move on now to why I wrote the book. And so I wrote the book because I was working with students at the University of Arizona, and I started a course, Physiology of Mind-Body Interactions. And the students who were attracted to my course were the ones who were wanting to go to medical school, PT school, osteopathic school, dental school. They really wanted to get higher certification in medical fields. And they were very hardworking, highly motivated. And as a result, they were stressed. And so they came to my course because in this course, I was offering them ways to regulate their stress by stimulating the vagus nerve. And so it was a very practical course. we used instruments or sensors for heart rate variability. Heart rate variability is a good marker for stress. The higher the heart rate variability is, the less stressed you are, because the heart can adapt and function to the body's needs better, because the vagus input is working. And when the vagus input is not so good, when you're stressed out, there's not so much variation of the heart rate. And so the heart doesn't adapt to your body's needs so well. So they learned ways to measure their heart rate variability and different ways to stimulate the vagus nerve to improve their heart rate variability and reduce their stress. And they liked the course. I've got some comments here. This class has been one of my favorites of all my years at the U of A, and I will be incorporating the teachings into everyday life for as long as possible after I graduate. And then as a class, we persevered and navigated through the beginning of COVID in spring of 2020, a feat which should not be underestimated, and certainly one I will not forget. We all made good use of the breathing techniques you taught during that confusing time. I will always use these techniques to increase heart rate variability and activate my vagus nerve, especially as I go through dental school these next few years. So you can see that not only were they stressed because of their studies, but they were also stressed because of COVID, as everybody was. So this was a very timely use of these techniques that I'm describing in the vagus nerve book. So this book is not just for students. This book is for anybody who wants to learn different ways to increase or activate their vagus nerve so they can control their stress better. And in the book, I talk about various techniques that you can do by yourself, such as breathing techniques. Breathing is like a big exhale, just going, that alone will activate the vagus nerve. So breathing, and then of course singing as well, because the laryngeal branch of the vagus nerve is right next to the vagus, right next to the vocal cords. And so if you're singing, that means the laryngeal branch will be activated, and that feeds into the main vagus nerve, and the whole thing will be stimulated. So singing in the shower, that's another great way to activate the vagus nerve. Then there are others that require therapies, such as massage, colon hydrotherapy, acupuncture, biofeedback, Reiki. So these are therapies that involve stimulating the vagus nerve. And this book is also for therapists, to give you ideas of how you can adapt your particular therapy to stimulate the vagus nerve. And then there are various activities you can do in groups that are fun, such as laughter yoga, because laughing, it uses the lungs, it uses the voice. And so that's another good way to stimulate the vagus nerve. So laughter yoga, and of course the movement of yoga. And then singing together, that's another one. So there are many ways that you can activate the vagus nerve. And this is just another diagram to show a bit more clearly the branches of the vagus nerve. So remember, vagus nerve is number 10, which is the bottom one here. And then you can see branches off to the heart, to the lungs, to the liver, etc., to the intestine. And then more of these other cranial nerves, the lacrimal gland, so crying is mediated through the vagus nerve, salivary glands. And here, all 12 of the cranial nerves, I'm not going to go through all of them, but just ones that I might talk about today. So olfactory nerve, this is very important. So when you smell certain odors, this So smell is the only sense that's directly connected to the brain. It doesn't go through numerous other nerves before it gets to the brain. It goes directly to the brain. So that's a very, very important sense, smell. And you can use aromatherapy. So there's quite a lot of research that's been going on with aromatherapy to see which essential oils will increase activation of the vagus nerve. And lavender is one for sure. There's research that shows that lavender does that. In fact, I did a study on horses, and we were able to measure the heart rate variability of the horses before and after they received lavender. And they were far more relaxed. The vagus nerve was stimulated by lavender. Then the facial nerve, so facial expression, that's very important. And smiling just like that, yeah, there you are. Even a fake smile will activate the vagus nerve. So that's another important thing, facial nerve. And then, vagus nerve down here. And here we have the spinal accessory nerve going to muscles in the neck and shoulders. And so this is important in massage. So, just even doing it yourself, massaging your neck and your shoulders, that can also activate the spinal accessory nerve, which feeds into the vagus nerve. So what activates the vagal complex? Eye movement. Eye muscle branches of the vagus nerve, smiling and laughing, facial muscles, and the trigeminal branch. Salivating, swallowing, tasting, the pharyngeal branch. And so these three, it's interesting because these three are involved when you are out with your friends, having a great time and having lots of social contact. So social contact will activate the vagus complex because you're looking, you're smiling, you're laughing, you're talking, maybe you're eating, salivating, tasting, swallowing. So that's a nice, easy way to activate the vagus nerve. That's a lot of fun. Singing and chanting, as I said, the vocal cords are next to the laryngeal branch. Smelling aromas, olfactory branch. And I mentioned using the neck muscles to orient, just to look around as you converse with your friends, spinal accessory branch. Laughing, both the pulmonary and the laryngeal branches, because you've got the lungs taking in air as you laugh and expelling it, and then the sound that you make. Deep, slow breathing, that's a really easy way to activate the vagus nerve, the pulmonary branches, and digestion. So mindful eating is really good, not just kind of gulping down your food in a rush, but eating mindfully and tasting it. That is very good for digestion and activation of the vagus nerve. And even feelings of awe and gratitude, going out into nature and being in awe of the beautiful scenery, especially now in spring, that will activate the cardiac branch. So emotions, really positive emotions like awe, gratitude, and appreciation will activate the vagus nerve. And receiving Reiki, that works through the cardiac branch. So going on to Reiki. How did we discover that Reiki uses the vagus nerve in healing? Through physiological measurements on humans and on animals under stress. So there, my rats come in, some of whom received Reiki. So we would do experiments, not just me, but other people as well, on people or animals who were stressed. And we would see if, when they received Reiki, if the vagus nerve was stimulated. And we could measure that by seeing if the heart rate went down, because that's consistent with stimulating the vagus nerve. Did the heart rate go down when they received Reiki? Did heart rate variability go up? So was there more adaptability of the heart? Did blood pressure go down if required? So we measure how the heart responds to Reiki in people and animals under stress. And with heart rate variability, there are, those of you who are familiar with heart rate variability, heart rate varies with different frequencies. And the high frequency of variation is that reflects a vagal stimulation. So if the high frequency component of heart rate variability goes up, that means that the vagus nerve is stimulated. And this is just to show you heart rate variability. So that graph there, each spike represents a heartbeat. So this is an EKG. And you can notice that the spikes are not equally spaced. Some are further apart at the beginning and then get closer together. And that's good. That shows that we have some variability in the heart and it's not just a robot. And here you can see how each pulse or each beat of the heart is connected to the heart rate. So you can see at the bottom the spikes, and you can see as the spikes get further apart, say in the middle, the heart rate, the blue line, is low. So there's more time between successive heartbeats, the heart rate is low. Whereas a little bit before that, you can see the spikes are close together. There's not so much time in between successive heartbeats, and the heart rate is higher. So that is heart rate variability at the top, and that's what we want to see, these like rhythmic humps, up and down, heart rate's going up, and then it's coming down, going up, then it's coming down. That means sympathetic and parasympathetic parts of the autonomic nervous system are cooperating. They're talking to each other and they're not fighting each other. And the heart can change its function, its heartbeat and its contractility according to the body's needs very easily. And also recovery. So if you've been maybe you've been angry with someone and your heart rate goes up and your blood pressure goes up, then if you have a high heart rate variability, then it can quickly adapt and come down when you finish being angry. So that's an important thing too. And that fits in exactly with something I heard today, a new study that's been done that shows even brief episodes of anger can increase heart rate and blood pressure. So if you can practice maybe breathing exercises or one of the other ways of stimulating the vagus nerve, then you will have a better recovery after you've been angry and also after extreme exercise, reduced recovery time. So evidence. So I'm going to give you some articles that show that Reiki does seem to stimulate the vagus nerve or work through the vagus nerve. So 2008, a long time ago, that's when I did my work with the rats. The rats were stressed by noise because of the environment they were in. And when they received Reiki, so one group would receive Reiki, 15 minutes a day for 3 weeks every day. One group would receive sham Reiki, where a student without Reiki experience was pretending to give Reiki. And only the ones who received real Reiki showed reduced heart rate rather than the high heart rate that the noise was producing. So when the rats were stressed, the heart rates were high. And when they received Reiki, the heart rate went down, but not with sham Reiki. Then another study, Diaz-Rodriguez, 2011, this was done on nurses with burnout. And they received 30 minutes Reiki or sham Reiki for 1 week, and the next week, the ones who received Reiki received sham Reiki, and the ones who received sham Reiki received Reiki. And in both cases, only when they received Reiki did they show an increase in heart rate variability, meaning their heart was adapting better and the vagus nerve was stimulated. Another study in 2014, Sally's et al., that was with 66 patients with hypertension, high blood pressure, and they received either Reiki or sham Reiki or nothing or rest. And the Reiki group showed the largest decrease in blood pressure, indicating that the Reiki was stimulating the vagus nerve. And then another study I was involved in 2017, 45 patients who were hospitalized for knee replacement surgery. They were in 3 groups. 15 received Reiki, 15 sham Reiki, and 15 were just having rest. And only the Reiki group showed a significant decrease in blood pressure 1 and 2 days after surgery compared to before the surgery. Then Friedman et al. 2010, 49 patients recovering from acute lack of circulation to the heart received Reiki or classical music or rest. And in the Reiki group only, the high frequency component of the heart rate variability, which strongly reflects vagus activation, only in the Reiki group did that increase. And if you want to find summaries of these papers, you can get them if you go to centerforreikiresearch.org. So other techniques we can use to power up the vagus along with Reiki. Well, I already mentioned lavender aromatherapy, and that's a great one because very often Reiki practitioners will have the vaporizer going with some nice essential oil in the room. And so lavender is a good choice because there's scientific evidence showing that lavender aromatherapy does increase vagus activation. So if you do that along with the Reiki, then you've got a good chance of getting nice and relaxed. Those of you who are familiar with Reiki, there are symbols. You're given symbols, at least in levels 2 and 3, symbols for Reiki. And chanting those symbols, you can chant the symbols while you're doing Reiki, and the chanting will also activate the vagus nerve because remember, the vocal cords are right close to the laryngeal branch of the vagus nerve, and so the vocal cords vibrating will stimulate that nerve. And then the deep breathing with Reiki. And this, so I do Usui Reiki. I also do Karuna Reiki, but this is Usui Reiki. Mikao Usui developed Usui Reiki, and he did this breathing with his students. And this was in the end of the 1800s, beginning of the 1900s. There were no sensors of heart rate variability, but somehow he knew that the deep, slow breathing was important to do with Reiki. And so he developed this way of breathing called the Gasho breath. And Gasho means hands in heart position. And we will do some of that in a minute. But before that, I'm just going to look at the aromatherapy, so the olfactory nerve, just to show you why aromatherapy can stimulate the vagus nerve. So at the bottom here, this is the inside of the nasal passages, the inside of the nostrils, the mucosa. And here's the air and the odorant coming in. And there are cilia or little hair-like structures in the mucus that connect to nerves that detect what it is that you're sniffing right there. And that information is taken along the nerves to the olfactory nerve. So these tiny little nerves lead onto the olfactory nerve, which then feeds back into the limbic system of the brain. And you can see here, there's someone smelling a rose, and you can see the odor is going in through the nasal passages and being detected by the cilia, and that information is going through the tiny little nerves to the olfactory nerve or olfactory bulb, and you can see the olfactory bulb leads right into the brain, into the limbic system, which facilitates communication between the mind and the body. And you can see different parts of the limbic system here. The amygdala, where emotions are stored, emotional memories are stored. The hippocampus, where factual memories are stored. So amygdala stores emotions and memories connected with those emotions, and the hippocampus, more factual memory. So that's why there's a link between often you smell something and then you remember when you smelt it and how you felt when you smelt it. And that's because that smell is going straight to your amygdala and waking up those emotional memories that are stored there. So for example, maybe you're smelling freshly baked cookies, and then you would just go back to when you were a child and you were in your grandmother's kitchen, and that was the smell that made you feel so happy. So there's a good link between what you're smelling and emotional memories because of this direct link from the olfactory nerve to the brain. And here you can see the olfactory bulb connected to all different parts of the limbic system. And also not just the limbic system, but to the cortex, the thinking part of the brain. So I mentioned chanting the symbols. And when you're chanting, that's the laryngeal branch and also the pulmonary branches because you're inhaling and exhaling as you chant. And there's a CD, Jonathan Goldman's CD Reiki chants, Reiki symbol chants, that is a good one to listen to and maybe join in with. And I got this picture here from an article that was written by somebody who is in the International Association of Reiki Professionals. And in fact, I should have her name here. Eleanor Curry, and she said in her article that chanting the Reiki symbols creates a vibration that impacts first the physical body, particularly the glands, organs, and nervous system, and then subsequently opens greater awareness to the participant, connecting them more clearly to their wisdom, higher self, and divine intelligence of the universe. So this is a really great way to stimulate your vagus nerve and connect to greater, higher things. So now let's do some gasho breathing. So with gasho breathing, as I said, gasho means hands in prayer position. So we can put our hands in prayer position. And we're going to breathe through the nose. And you can breathe out through the nose or out through the mouth, whatever is most comfortable for you. And when you breathe, I want you to like fill your whole lungs right down to the bottom. So I'm just kind of stomach breathing rather than chest breathing. So it should be your stomach that's moving. And a good rhythm is 5 seconds in and 5 seconds out. And if you know Reiki, as you breathe in, you can imagine the Reiki is coming through your crown and filling your entire body. And as you breathe out, you can imagine the Reiki is leaving out of your body, going out radially through every pore into the environment. If you're not familiar with Reiki, you can just imagine you're breathing light through your crown. So breathe light in through your crown so it fills your entire body. And as you breathe out, imagine that light is radiating out of every pore of your body. So let's do this together for a few minutes. Well, thank you. So I've almost finished, and when I give the screen back to everybody else, I'm going to ask you how you felt when you were doing that. And it's interesting because when I was doing it, one thing that it does, that deep, slow breathing, activating the vagus nerve, if you remember, I said it helps you think more clearly. Your heart rate variability is higher. You're in a more aware state, and it helps you think more clearly. And it reminded me that I'd forgotten to tell you something, so I will do that as well. So how does the Gasho breath affect your heart rhythm? So this is how the heart rate changes with time. And I think this is about 3 minutes we're looking at. So heart rate on the y-axis and time on the x-axis. And with usual breathing, which is usually kind of fairly shallow and maybe fast unless you're a meditator, you can see the heart rate kind of randomly goes up and down. There's no real pattern to it. But if you're doing the Gasho breathing, you can see there's a very particular pattern. So as you breathe in, the heart rate goes up. There's less vagus activation. And as you breathe out, the vagus nerve gets activated. Every out breath, lots of vagal activation, and the heart rate goes down. So that is Gasho breathing. And that when that signal, that very one that's very easy to identify, that signal goes through the vagus nerve from the heart to the brain. That's where it gets to the brain, it gets to the amygdala, it helps you control your emotions, and also it gets to the cortex and helps you with your cognitive processes as well. So doing the Gasho breathing in combination with Reiki is really, really powerful.
And can I ask a quick question on this?
Yes.
And my ignorance in heart rate variability, looking at a graph.
Mhm.
So my understanding for heart rate variability is we want it more varied
Yes.
rather than a rhythm. So can you just explain how the Gestalt breathing is creating more heart rate variability?
Okay, so it's this, okay, so it says usual breathing at the top there. Usually there isn't quite so much variation. So maybe if I had someone who was a little bit stressed, you wouldn't see these spikes here. You'd see much less variation. So the Gasho breathing does two things. Number one, it increases heart rate variability, meaning that there's more variation between the minimum and the maximum.
Okay, got it.
It does that, and also it produces this pattern, this rhythmic pattern,
Okay,
which
thank you.
the brain recognizes. Thank you. So when your heart shows the Gasho rhythm, that means your autonomic nervous system is in balance. That means sympathetic and parasympathetic are working alternately. They are working together. They're not fighting each other. And they're not, and we don't have predominant sympathetic as when you're angry or anxious. The sympathetic will overwhelm and the parasympathetic won't be able to function. So as you breathe in, sympathetic nerves are stimulated and heart rate increases, and there's less stimulation of the parasympathetic or the vagus. And as you breathe out, the parasympathetic nerves, the vagus nerves are stimulated and heart rate decreases. And this pattern that I showed you is called a state of coherence. And it feels like relaxed alertness. And that is a really good state to be in because it means you're ready for anything. So if you remember when that plane came down in New York City and the pilot landed in the Hudson River, do you remember that? Solly, I think, Captain Solly. Airline pilots are trained to achieve this state of coherence. And if he hadn't, there's no way he could have landed that plane in the Hudson if he hadn't been coherent, because you need to be relaxed enough not to freak out and with it enough to know exactly what you have to do and what order to do it in. So it's a very powerful state, and anybody can achieve that state. And when you are in this state, your heart rhythm and your breathing are synchronized. And this shows you, these are recordings. This is from a teenager, actually. And the pink, if you look at the middle panel there, where there's a blue wavy line, the blue wavy line is each breath. So each hump is a breath with the blue wavy line. And the pink line is the heart rate. And you can see the heart rate is going up and down, up and down. So this teenager is in a coherent state. She was asked to breathe about 5 seconds in, 5 seconds out, and slowly and deeply. And you can see that as she was breathing in, the pink, if you look at a pink hump here, breathing in, the blue line is going up. She's breathing in, the heart rate goes up. Breathing out, the blue line's going down. The pink line also goes down, heart rate goes down. So you can see that the breathing and the heart rate variability are synchronized. So that's another thing about coherence, there's synchronization of the different systems in the body. And brain waves are synchronized with this as well. You tend to go more into the alpha brain waves. So why does gassho breathing help people give and receive Reiki? It's the best state to receive energy and information, including Reiki. You're a clear, neutral, non-judgmental channel. And so when I was doing it just now, I received some information that I had forgotten. And what I wanted to say was that another thing that is different about my book is that I talk about the different therapies that can help you with stimulating the vagus nerve. And each chapter has one or more case studies by a therapist who is utilizing that particular technique that the chapter is addressing. And so these therapists, they're all from Tucson, and I personally know all of them, and they all contributed a case study to the book. So I think I may just read a short one here, if that's okay. Is that okay? Right. Okay, this one's on aromatherapy by Nora Dykema, energy healer. My client arrived experiencing a high level of anxiety, describing it as a 10 on a scale from 1 to 10, with 1 being the lowest level. She seemed scattered. She commented on the room, saying it was beautifully furnished, and she especially liked the couch and the gold-colored chaise longue. I asked her to participate in an aromatherapy exercise to see if it would help her. She seated herself in a reclining position on the gold chaise longue and smelled Stress Away essential oil blend. So this is a mixture of lavender and chamomile. Chamomile is also a good one for relaxation. My client breathed in deeply through her nose 3 times and immediately experienced a release of an air bubble, client's words, shooting out of her left shoulder and another out of her right foot. Her body language became more congruent with her feelings as she became more relaxed with me. She started talking about the reasons for her anxiety, and her eyes filled with tears as she spoke about why she had come for help. Her hands were coming up to shoulder level, palms upturned, indicating her frustration while describing her situations. Her voice would crack at times, and she was holding back from fully crying. After a few minutes, she took 3 more deep sniffs from the bottle. She relaxed more and was able to feel her left ear opening up. A spot on the top of her head opened, and she felt more openings of flow in her shoulders and left side of her neck. After a few more minutes, she took 3 more sniffs. She began to feel sleepy, but noted that this was because there was so much stress leaving her. I asked her to share where her level of stress was and anxiety was at this point, which was about 15 minutes in, and she noted it was down to a 4 and was starting to feel an effect hitting her heart area. An opening had occurred that was moving some stuck bad energy, client's words, from her heart, and she was very surprised and decided to relax even more as she noticed this helped her feel the path of aromatherapy working in her. She began to feel a widening of energy open up in the left side of her neck as if it was expanding. She felt happier and hopeful, client's words, as she had been struggling with some upsetting events. Her head was clearing, and she said she was feeling so much better, and her mood of anxiety had dropped to a 2. She noted that there were arteries and veins opening and that she could feel her energy was definitely being moved in a healthy way. My client was noticeably calm and happier after the aromatherapy, and she commented that she was feeling hopeful. I felt she was a little giddy about having felt so much better. she was excited about her session. All of this took 24 minutes. So there's a case study on aromatherapy. And so this is ending now. So I hope that from my presentation, you have learned something about the anatomy and functions of the vagal complex. I remember there are 12 cranial nerves, and the vagus nerve is the biggest one, and it's number 10. But there are also these other nerves that go along, that work with the vagus nerve. And then how different ways of activating the vagal complex relate to its anatomy. So going maybe to the laryngeal branches and doing the singing, and then maybe going to the heart for the emotional feelings of gratitude and awe, and then the pulmonary branches for the breathing. Evidence that Reiki healing operates through the vagus nerve. So I went through those articles showing that the people who were stressed and received Reiki showed reduced heart rate and in some cases increased heart rate variability. And then the influence of deep, slow breathing on vagus activation and heart rate variability. So if you want to buy the book, you can get it from Singing Dragon, or you can just go on Amazon. There are links here. And my other book, Reiki in Clinical Practice, if you're interested in that, you can also get that from singingdragon.com and also from Amazon. Reiki in Clinical Practice, a science-based guide. And in that book, I go through the scientific data that supports use of Reiki for various different applications. And so then I'd like to say thank you and hope that you enjoyed it. And let's open up for Q&A.
Yeah. I'm not sure if we can take some questions. I don't know if you can touch to what Reiki is for a moment, Anne, just because you wrote a book on it. So just a little insight of what is the background of Reiki and what Reiki is.
Yeah. So Reiki means universal life force energy. And it was kind of rediscovered in Japan at the end of the 1800s. And it's a form of energy healing. So basically, there's energy in the universe that can be channeled through you and then come out of your hands. And so if you place your hands on a person or hover them over the person, they will receive that energy. And the Reiki works to bring the mind and the body back to balance. You can also send distant Reiki, like across the world or another planet or wherever. You can send distant Reiki to. But there's less research on the distant Reiki. There's much more research on hands-on or hovering the hands Reiki. And it's thought to work through the autonomic nervous system, through the vagus nerve, and also through the hormonal system. So any other questions or comments? So how did you feel when you did the Gasho breathing?
Hey, Anne, I have a question. Thank you so much. This was a great presentation, by the way. I would like to know, would you be able to do some of the Reiki chants or let us experience what that sounds like?
No, I can't do that right now. Not for the Reiki symbols, because you're not supposed to use that unless people have been trained to Reiki level 2.
Oh, okay.
You can chant anything.
Do what? Say that again.
You can chant anything. I mean, you can chant like yoga chants and and etc.
Okay. I was just curious if it was something super specific that you were chanting that would be helpful. So, okay.
Yeah, those symbols are helpful, but not until you've had the attunement and you've had those symbols put into your chakras.
So then if you're working on a client that has not, so if I'm giving Reiki as a practitioner to a client and wanting to stimulate their vagus, activate their vagus nerve and balance it out, but so you said it would be beneficial for them to be on the table as I'm giving Reiki, but also chanting or using their vocal cords in some way to.
No, you don't need to do the chanting. That's
Okay.
just great. That's just an additional thing.
Okay.
The chanting is more for healing self. So you do self Reiki and you chant. So I
Okay.
didn't. You don't usually do that with clients. With clients, they're just lying on the table and you give them Reiki, and it's all very simple, very, very simple and easy.
Okay. Okay.
This is stuff to add on when you're, so the chances are for when you're doing Reiki to yourself, because you can do Reiki to yourself. And also when you give Reiki to others, because the energy is flowing through you, you automatically get it to yourself as well.
Right.
So you never get drained giving loads of Reiki to people because you're receiving it too.
Absolutely.
But one thing you can do if you're giving Reiki is, of course, you can have the lavender going in the aromatherapy. So you can add that too.
Okay. Have you ever used any like sound frequency, like sound healing, or have any studies on that as well with the vagus nerve, like or different frequencies? You know, because of activating the.
There's a lot of work done on that. I'm not familiar with that area. I'm not expert in that, but there's a lot of work on different sound frequencies and how they affect the autonomic nervous system.
Nice.
And lots of systems you can get that will see what frequencies you're lacking, and then put together these sounds, these musical sounds that will give you those frequencies.
Thank you. Yes, thank you very much. I thoroughly enjoyed your presentation.
Good.
I have a question. How often would you recommend that somebody that has stress get Reiki, or does it just depend how they respond? Like, is there a certain amount of sessions they would normally do, or?
Yeah, so it depends what people want. So if they're going through a stressful time, or it's just like an acute stress, then I would usually probably about 3 or 4 Reiki sessions. And Reiki sessions could be half an hour or 1 hour. 3 or 4 sessions should do the trick. But then a lot of people come to me for like maintenance. And so they come maybe every couple of weeks or every month for a Reiki session, just like you would for a massage.
Okay, thank you.
Hi, Anne. I have 2 questions for you related to like dealing with trauma, and I think how it ties into the vagus nerve. The one is I'd heard a fact, and maybe you can verify or speak to this, that the vagus nerve is, I think, 80% afferent going from body to brain, and only 20% going from brain to body. And that's part of like the reason why body-based practices can be so powerful in like stimulating the autonomic nervous system and helping to clear trauma.
That's exactly right. Yes,
I think that's a very interesting fact to know. My second question is, I don't know if you can speak to how does co-regulation affect the vagus nerve? Would that be through a similar pathway as like the Reiki? If you're co-regulating like a mother with her baby, or like a therapist with their client?
So the co-regulation, that's really fascinating. So the Institute of Heart Math, they've done a lot of research on that. So it's all through the heart. Mm-hmm. So your heart rate variability doesn't just stay in your heart, because your heart has a big electromagnetic field around it. Mm-hmm. And each time your heart beats, it's an electric current, which then creates an electromagnetic field. And so if you're coherent and your heart rate is going up and down like that, pulsing, it means your electromagnetic field is pulsing too. And so if you are close to somebody and your electromagnetic field, your heart field is pulsing, then theirs will start pulsing with it. Theirs will synchronize with it. So yes, the co-regulation really seems to work through the heart and through the vagus system.
Very cool. Thank you.
And they've done experiments showing that, especially with mother and baby. Yeah. Mm.
Thank you.
I've done it with horses too. It's amazing. The horses are very, very sensitive to the heart field. They can pick it up and they come right up to you.
I've actually heard that before, and I was gonna mention that they're very energetically attuned, and I've had patients talk about that before.
Yeah.
So it makes sense you have that passion and overlap there. I was gonna say with the gasho breathing, I felt a calm clarity and sense of peacefulness within the first 2 rounds of it. Very, very lovely. And then one more comment on the slides that you were reading, the quotes from your students, you just radiate the love that you have for that profession. It was wonderful to see that. So thank you for sharing that.
So much. Yeah, I really enjoyed working with those students, especially through COVID. I mean, it was before they had the vaccines, so we were just in there with masks. Yeah.
Thank you.
Any other questions from the group? No, we can go down lots of rabbit holes with the vagus nerve. Yeah. So thank you so much for sharing this. Do you teach information on heart math as well?
Oh yeah, I do heart math. Yeah, I do heart math sessions, and then those are educational sessions. Yes.
Yeah, it's something I've been curious about. So maybe a future mini presentation or make a little mini video and put it on the YouTube channel too.
Yeah. That would.
Yeah. Has anybody here ever had a heart math session? Anna's nodding yes. Anna's
Yeah,
tried.
we've done a lot with heart math. It is fascinating, and we do a lot of coherence healings as well. So like we were talking about distant healings and work on each other. You just drop into your heart. It is. It's incredible, like how powerful we are. And most of us don't realize it, but once you do realize your power and you can do anything. I mean, you can go anywhere and do anything. So yeah, heart math is, I started out with just the sensor. I would use the little sensor and Sarah actually, who's on the line as well, she uses heart math in her meditations to see how quickly she can get into coherence. And it's been really cool work to be able to now like try to use it to help people like that aren't in the same room, so yeah.
That's right. And it really fits in with the Reiki very well.
Yeah. That what the question, let's see, it was from Catherine, like it would be really cool with what you're doing with mom and baby to learn about the coherence and the heart math stuff. I mean, they're already in sync. If you got into sync with them, like, oh, like the work you could do, it's like, it's so amazing. It's so amazing what you can do. And then too, everybody here, their therapist, like, we would just get on Zoom and I would start breathing in a coherent state, just like the gasho breathing. And no one in my team would know I was doing it, but I could get us all into coherence so quickly.
Yeah.
And you could just see everybody just would calm down, like they just relaxed a bit, And so, and then you had asked about the sound frequencies. So like I would always just play a frequency, maybe like the frequency of connection in the background. Like people couldn't hear it. I could hear it. It would just be really light. And then I would start doing the breathing during a meeting and be on camera, and I mean, people were kind. They they were just present. They could think clearly. And so to think that like you just, one person has that impact just from your breathing. So, and what you're doing is incredible.
And
Thank
then businesses too. It really helps businesses. And when they have meetings, just imagine if everyone did some coherent breathing before they started.
Yeah. Super interesting.
Yeah.
And there's actually Eric Marlene from the Barral Institute is going to be bringing his vagus nerve class here. I think it's April of 2026 or 25. I'll have to get that info. But I've taken his class and he talks a ton about heart rate variability and coherence and techniques to treat the physical part of the vagus nerve, again, to help downregulate, and teaching patients self-care techniques to physically work with it. I teach people ear pulls and the fascial sheath of the neck and balancing your sphincters and chakras and all these physical pieces. And here, all this time I've done all this, and I know, Catherine, about the 80% afferent, 20% efferent. But when you said, oh, that's why touch is so important too, I'm like, oh my gosh, no kidding. Because when we're working, you feel that patient downregulate. You feel them settle and get heavy in the table. They totally start taking those deep parasympathetic breaths. And it's like, of course, as their system decreases that input of danger from the environment and their system starts to self-regulate, that breath work almost comes with it. And then to include that while you treat, that seems pretty awesome.
Yeah, when I give Reiki, I'm always doing the coherent breathing as I do the Reiki. Yeah.
Any other comments or like those moments where we're like connecting the dots? Right? Okay, well, thank you so much, Anne. And we know how to find each other on Facebook, and then Anne, you and I will be in touch of hoping to get this video edited and posted, and we'll go from there.
Okay, thank you. Thank you very much.
Thank you so much, Anne.
Thank you, Anne.
Do the thumbs up. Do the double thumbs up. We'll give you fireworks, Anne.
Hold
Hold them sideways. Hold them sideways.
Oh,
If you have an iPhone. Maybe if you don't have an iPhone, I thought Zoom does it for everything.
what about this one?
Oh, the hearts. There
There
you
you
go.
go.
Technical love.
That'll work.
Heart rate variability.
Oh, yours is doing it. Mine's not.
Mine's not either.